Clubfoot. And the things you must know. Clubfoot is a common type of birth defect that affects the muscles and bones of the feet. Clubfoot is seen in children. It is normally termed congenital talipes equinovarus. It is congenital deformity because it is present at birth, meaning a child with the deformity was born with it. Clubfoot deformity can affect one or both leg. A unilateral clubfoot is when the deformity affects one leg. However, when it affects the two legs, it is known as a bilateral clubfoot. A clubfoot is properly defined as a deformity in which an infant's foot is turned inward, often so severely that the bottom of the foot faces sideways or even upward. A clubfoot is twice as common in boys than in females. Early treatment is necessary to correct the deformity. Children with clubfoot should be able to take part in regular daily activities once the condition is treated. Instead of being straight, a clubfoot points down and turns in. This twisting causes the toes to point toward the opposite leg. Approximately 1 in every 100 live births will have clubfoot, making clubfoot deformity one of the more common congenital foot deformities. Clubfoot is not painful during infancy. But if your child's clubfoot is not treated, the foot will remain deformed, and he or she will not be able to walk normally. With proper treatment, however, the majority of children are able to enjoy a wide range of physical activities with little to no trace of the deformity. A clubfoot is usually found on an ultrasound around the 20th week of gestation. If not, it's diagnosed when the baby is born. Due to some mothers' failure to attend antenatal care, often the condition is not spotted throughout the gestational period, and the child will be born with it.
Clubfoot can be classified into 3 different forms: idiopathic, which has no known cause; neurogenic, which is caused by a condition of the nervous system; and syndromic, which is related to a particular underlying syndrome.
Idiopathic clubfoot is the most common form of clubfoot. Normally, it is the one whose cause cannot be traced. Half of babies with an idiopathic clubfoot presents with a unilateral clubfoot, and often baby boys are twice as likely to have this form of clubfoot compared to baby girls. The reason to this variation is, however, unclear. A neurogenic clubfoot, on the other hand, is caused by an underlying neurologic condition. For instance, a child with spina bifida could develop clubfoot later in life. Also, a child can develop clubfoot later due to cerebral palsy or spinal compression. Contrary to these 2 previous forms, a syndromic clubfoot, however, is found along with a number of other clinical conditions, which relate to an underlying syndrome that the child may have. Syndromes which can result to clubfoot deformity include arthrogryposis multiplex congenita, constriction band syndrome, tibial hemimelia, and diastrophic dwarfism. The main cause of clubfoot deformity is unknown. Inasmuch as no known cause has been established for this deformity, and particular clinical conditions can cause clubfoot, quite a number of factors can predispose as a child's risk of developing clubfoot. These factors include inadequate amniotic fluid during gestation. This is known as oligohydramnios. Also, family history of clubfoot, parental age, smoking during pregnancy, male gender, using recreational drugs, for example, use of aphrodisiac or use of drugs for enjoyment without medical approval, are all factors that could predispose as a child's risk for the deformity. Symptoms of clubfoot deformity are widely described. There is inward rotation of the affected foot of feet. In bilateral cases, the toes point inward to face each other. In unilateral case, the affected foot looks quite smaller and shorter compared to the normal foot. There is also a heel cord tightness due to the equinous nature of the foot or feet. Stretching the affected foot to normal anatomical positions returns back to the deformity state upon releasing the stretch force or hand. Clubfoot deformity is not painful, but when left untreated, the child will walk on the dorsum of the foot, which may cause some pain to the child.
Clubfoot deformity can be spotted with an ultrasound. During the 20th week of gestation, taking an ultrasound of the mother can clearly determine if the child has developed a clubfoot. When the child has a clubfoot deformity, a doctor, physiotherapist, or pediatrician can observe the foot or feet for further evaluation. If the deformity is suspected upon physical examination, an X-ray of the foot or feet can be taken to confirm the case.
By far, clubfoot is treatable. Depending on the severity of the deformity, surgery, bracing, and the use of the Ponseti method can be adopted for clubfoot treatment. The latter is the most widely used treatment technique worldwide, and its effectiveness has been proved to be positive. Clubfoot treatment has been free in specific healthcare centers in Ghana. Early treatment averts a number of complications and prevents further deterioration of the condition. The Ponseti method is very effective when treatment commences early following diagnosis. Your physiotherapist or pediatrician understands this method so well and knows its application. Always consult any of these specialists for clubfoot treatment.